Hello, my name is Glenda Stansberry, and I have the pleasure of introducing this tape for you today. Now, if you're sitting in a training setting, I'm sure you're going, oh no, another boring training tape. Time for me to balance my checkbook or clean out my purse. But before you check out, let me share with you that this is no ordinary tape, and this is no ordinary trainer. You're about to spend a few minutes with Doug Manning. Doug is an author, a counselor, and a speaker who has traveled all over the United States, just learning how to be with folks as they walk through emotional pain. He doesn't speak in psycho jargon. He doesn't have a whole battery of tests to validate that his skills work. Instead, he has a whole lot of people who've been able to say to him, gee, I'm glad you spent this time with me. And he would like to share those kinds of skills with you. As we talk today, I would invite you to focus on a family member or a friend or a client or a patient who may be facing going through death or going through the grieving process, and see if you can't pick up some insights and skills into how you can be there for that person and offer them the gift of comfort. I now present to you Doug Manning as he visits with you about the gift of comfort.
A professor in Texas asked his class every semester what one thing more than any other thing gives meaning and purpose to life. The class, of course, guesses love, faith, and the professor then says no. The one thing more than any other thing that gives meaning and purpose to life is death. The longer you think about it, the more truthful that statement becomes, because if there were no end to life, we wouldn't hold it very dear. And if there was no end to life, we would never be motivated to ever get anything done. But what the professor's really trying to do is get across to his students that we in America do not do death well, and we need a new view of it. You see, in America, we think if we avoid it, we won't ever have to face it. We can't really even call it by its name. We have such names as going to sleep or lost or passed away, anything to keep from saying that somebody died. And even in our funeralizing process, oftentimes we try our best to deny the existence of anything called death. I'm glad we're taking better care of ourselves now. And I'm glad that most of us have quit smoking, and I'm glad that we're eating better, and it's very evident that a lot of people are jogging. Now, I do not intend to jog with them, but there's a lot of people jogging, and I'm glad of all that. But you see, part of the reason we do that is our fear of death, and that part that comes from our fear of death is not healthy. See, you'll eat anything now if somebody tells you you'll live a little longer. They've got you eating oats. I sometimes think they'll have us grazing next. And I'm frankly quite tired of hearing about cholesterol. I laugh and say in groups that I hope that I ooze cholesterol for 3 days when I die. And I do all of that because I'm trying to get across to people that we almost desperately need, a new and better view of death, because our fear of death, our inordinate fear of death, is robbing us of some things that we desperately need. First of all, it robs us of dying ritual. A physician in a conference recently said, nobody dies of old age anymore. And I said, what do you mean? He said, we don't accept old age as the cause of death. There was a time when if somebody died that was old, you'd say, what'd they die of? And probably the answer would be, they died of old age. And we'd say, oh, that's okay. Yes, I understand that. Now he says you have to die of a disease that long after a tremendous struggle in the hospital because we just cannot allow death to happen without this tremendous struggle. My grandfather died when he was a very young man. Something bit him and he got blood poisoning. He knew he was dying, and the family knew he was dying. Nobody denied it. Nobody tried to go around it. They faced it, and in the process of facing it, he had dying ritual. It was almost like the scenes you see in movies. He had the opportunity of calling each one of his children to his bedside and talking with them about dying, about his dying and his death. He had one daughter that was always the rebel in the family, and he called her there twice. And so the whole history of our family has been spent wondering what he said to her, and she died without ever telling us, which was beautiful. But he had dying ritual because somebody was willing to let him talk about his dying and to actually listen to him as he dealt with his dying. First time I ever pulled a chair up beside a bed of a patient in a hospital and allowed that patient to talk about dying, I had to hold the chair with both hands to keep from running out of the room. I was not raised in that kind of intimacy. I was the kind of guy that would stand at the door and say, "Golly, you're looking better," to a patient that was only hours away from dying. And I'd throw scripture at him or a prayer at him and run because I could not handle it. I just could not deal with death and dying. This particular lady said, "I'm not going to make it." And with everything that I had, every strength that I had, I forced myself to stay there and say, "Do you want to talk about it?" And she said she did. And that's one of the more beautiful experiences of my life. Since that time, some of the great experiences that I've had have been built around actually giving people dying ritual. See, as people are allowed to talk about, very openly talk about death and dying, they actually began to face the issue and prepare themselves. I had a friend one time that had cancer, and he knew it. And he knew he was going to die. And people that are going to die, first of all, people that are going to die know they are. And people that are going to die usually will pick out one person they want to talk to. And I was his person. His wife would send for me at his insistence. And she knew that we needed to talk, and she wanted us to talk. But then when I got there, she just couldn't let it happen. She wouldn't leave the bedside. She and I would talk about it. She'd say, "Yes, I know, and next time. But it never happened. I tried one Wednesday at noon, and the whole family was there, and he wouldn't talk, and he died that afternoon, and it really crushed me. So I went over to the hospital, and I thought, well, I couldn't get a chance to talk to him, and he probably died without real preparation. But at least I can stay with him till the mortician comes. So I went in the room and sat with him. In the room was a little lady who was a housekeeper in the hospital. She didn't have to be in there. There's not anything for her to do at that particular time, but she was in there just being busy. And I said, "You became good friends with my friend, didn't you?" And she said, "Yes, I did." And I said, "You talked to him a lot too, didn't you?" And she said, "Yes, I did." And I said, "You talked to him about dying, didn't you?" And she said, "Yes, I did." And I could have kissed her. That wonderful lady gave my friend dying ritual. Since that time, I found out that a lot of times housekeepers and aides and nurses and other personnel in hospitals and nursing homes perform this wonderful service by simply being strong enough to live with and deal with what I call the ultimate intimacy, which is allowing somebody to talk about their dying. I had another case of a lady that was in a nursing home, and they called. I didn't know the lady, but they called and asked me if I could come. She was hysterical. When I got there, I found out that she couldn't talk. She had some disease that affected her throat, and she couldn't talk, so she and I had to become acquainted, if you can call it that, by her writing on one of these child's magic slates where you pull it up and the message goes away. We spent the morning getting acquainted. Finally, I said, "What are you afraid of?" And she said, "Death." And the minister in me, of course, I started to preach her sermons on death and dying, but I stopped and said, "Are you afraid of death? Are you afraid of dying?" And she said, "Dying." And I said, "Do you want me to find out how you're going to die?" And she said, "Yes." And I said, "Do you want me to tell you the truth?" And she said, "Yes." So I went to her physician and found out that she would choke to death. She was deathly afraid of choking. And I found out that she actually would choke to death, but that she would be in a coma and would not know anything about it. And I went back and told her. And I stayed with her for 2 years until she died. She never again was in panic over dying. Another lady wanted to talk to me about death, and the family couldn't let it happen. And right at the end, I was in the hospital. Her husband was across the room visiting with someone else. And she pulled me very close and she said, "I'm just so tired." And I said, "Are you saying you want to go on?" And she wouldn't answer that. She said, "Well, I have those grandchildren." And I said, "Yes, and you've done a good job raising them. And if you want to go, it's all right." And she pulled me very close and kissed me. And in 2 hours, she was gone. She just needed permission. See, that's the genius of hospice. Hospice says we will train people, and we will steel ourselves so that we can deal with this ultimate intimacy, and we'll put somebody at the foot of the bed that will let you talk about death and dying. That's beautiful. The first hospice call I know anything about was when Moses and Elijah came to visit with Jesus and talk with him about his death, which was to happen in Jerusalem. I said that recently, and a rabbi said, no, that's just 3 Jews facing reality. And I said, well, I can accept that too. If you really want to see the value of all of this, look at the crucifixion, not from any religious standpoint, but here was a person who was dying and he wanted to talk and there wasn't anybody to talk to. He wanted to talk about how he felt about his mother, and there wasn't anybody, and so he finally turned to somebody and said, take care of Mother. And he wanted to talk to them about how he felt about his friends, and there wasn't anybody, and so he said, Father, forgive them. They don't know what they're doing. And he wanted to talk about his pain, and there wasn't anybody, and he cried out, I thirst. And he wanted to talk about what it felt like to die alone, and there was nobody there, and so he screamed out, my God, why hast thou forsaken me? And he wanted permission to die, and there was no one to give it. So he finally bowed his head and said, into thy hands I commend my spirit. And he died. That's dying ritual. People need us to be strong enough to do that. Our fear of death also robs them of grieving ritual. Just as we can't talk about death, we have a difficult time talking with people about grief. I wrote a book called Don't Take My Grief Away From Me. The title comes from an incident. I had a couple who had a child, had the croup, became worse in the afternoon, took it to the hospital. They put the child under oxygen, which was all that was called for. This is not a medical mistake. And in about 30 minutes, the child died. And the wife was, of course, hysterical, and she was crying, and the doctor was trying to get her to calm down. Her husband was trying to get her to calm down, and she stopped and looked at them and said, don't take my grief away from me. I deserve it, and I'm going to have it. I always felt like that's one of the more profound statements I'd ever heard under pressure. But also was glad I wasn't there. Because had I been there, that's exactly what I would have been doing. See, I thought that you helped people when you took their grief away from them. We have it all backwards. See, we think people are doing well with their grief when they're not grieving. At my brother's funeral, somebody came up to me and said, you seem to be doing so well. And I said, no, I'm doing very poorly, thank you. And they said, well, you don't seem to be. And I said, look, if I were doing well with my grief, I'd be crumpled up over there in the corner crying my eyes out. That's when you're doing well with grief, not when you're standing here acting like nobody died. See, people in grief need to grieve. They need the opportunity to simply tell you how they feel and to actually grieve without our trying to take it away from them. We take it away from them when we try to put the best face on it. And our efforts to putting the best face on it causes us to say some things to people that are just almost unbelievable. It's almost like we think if we can explain it in a certain way, it won't hurt, and all the hurt will go away. And so we end up trying to explain it away, and that doesn't work. We try to take it away from people when we tell them to buck up. It's time to get over it. Or even religiously, we try to do it by explaining it in some way that somehow or other this is not supposed to hurt because God is in it. And none of those efforts work. People in grief need to grieve. The best definition or the analogy of grief that I've ever heard is involved with an onion. When I first wrote a book about grief, I talked about the stages of grief. And I don't like that analogy now because stages seem like they're so clear-cut that, you know, they're set, and everybody goes through these stages and they go through them at one time. The best analogy, or the analogy I use now, is that grief is like peeling an onion. It comes off one layer at a time and you cry a lot. And the reason I like that is that allows a lot of flexibility in our grieving. If I were in front of an audience of 1,000 people and I gave every one of them an onion, nobody would have an onion just like everybody else's onion. And nobody would peel it like everybody else's. Some would play with those little things on the bottom, and others would play with the thing on the top. Some would tear it apart. Some would just would peel it very slowly, and that's the analogy we want. People in grief need the right to grieve at their own pace and in their own way. There's no set way, no right way. You grieve like you grieve. The best thing you can say to people in grief is feel what you feel. You can't change the feelings, so just feel them and allow yourself the right to do that. I like the onion analogy because it fits. The outside of an onion is dry and crumbly. You can just make confetti out of it. It's a hull. If you took an onion hull and you squashed it up and you just made it into confetti and you threw it in the air, it's like a whirl. And the first part of grief is a whirl. 10,000 questions floating around up there. None of them land. As soon as they ask one question, before you can answer it, they have another question. That's why when this whirl is going on, basically we need to just allow them to question and allow them to continue to question, but don't get all wrapped up in trying to answer it or to explain it all away. Basically, it's that whirl. It's a time when it's real but not real. It's a time when it's like watching a sad movie. You cry, but you know that in a moment the credits will run and the movie will be over and it'll all be all right. That's that first stage. That's also the time when people begin to try or need to establish the significance, which we've talked about on other tapes. They need to establish the value of this person. Then they begin to get into that very first layer, and that first layer of the onion is what I call the reality period. That's when reality comes. All of that whirl stops. All of those questions and all that reality comes and sits right on your chest, and it won't go away. And your chest hurts and you can't breathe, and you call up people, you don't know why you called them. People in that stage need folks that will just be there. You don't need to say anything. Matter of fact, the less you say, the better. I don't know how many times somebody said to me, the people that helped me the most were just the ones that were there. The ones who helped the least were the ones that said too much. And said there are times when you just wanted to scream, hush, and let me grieve. There's no shortcut for that period. There's no way around it. People have to walk through it. Gradually, they get through that level, and they push on to what I call the reaction stage. The reaction stage is actually when they begin to start getting better, but it's also a time when we think they're doing worse, because the reaction stage is when they get into the anger of grief. And there's anger in grief. Stop and think about it. That's normal, because what's anger? Anger is a normal response to grief. And so they begin to express their anger. And unfortunately, when they do that, we start trying to explain it to them, and we start trying to change it, and we start trying to get them to think differently. Recognize that in grief, people are in transition. Where they are today is not where they're going to be tomorrow. So we don't have to panic. If they're angry about one thing today, they simply need us to understand. Fortunately, people keep peeling the onion until they get to the last layer of the onion, which is what I call reconstruction. They start putting their lives back together. They turn the corner in the way they cope. They don't get over it. They just turn the corner in the way they cope. And they begin then to rebuild. I think we clean people's houses out too quickly. The analogy of the onion says to me that we need to let people get rid of things in their own schedule and face things in their own schedule, because that's all part of peeling the onion. I met a little old lady from Pasadena who had an automobile. You know, you've always heard this car belonged to a little old lady from Pasadena who only drove it on Sundays, to the drag races probably. But I was speaking in Pasadena, California, and a little lady raised her hand and said, "You've just explained my husband's 55 Packard." And I said, "What do you mean?" She said he had a 55 Packard. It was his pride and joy. And said when he died, everybody told me, "You've got to get rid of that. It's too precious. It'll remind you of him," and do all these things. And she said, "I fought him. I said, I want to keep that Packard." She said, "I can't tell you how much anger I worked off polishing and washing that Packard." Said it had more chrome on it than I've ever seen on any car. And said I'd get out there and polish that Packard and cuss Charlie for dying. Said finally I woke up one morning and I wanted to sell the Packard. Put an ad in the paper, Immediately, somebody came out to look at it, and the first guy that did bought it. It said when he drove off, he had the same silly-looking little grin on his face that my husband had the day he bought it, and it was all right. She'd peeled her onion. But you see, we're not ever going to get comfortable with people having dying ritual or having grieving ritual until we ourselves get comfortable with death and dying. I'm not sure that we can ever be much of a comforter as long as we ourselves cannot deal with it. We need a new concept of death. I found one the other day, and I've read it around the country because it has such meaning for me, and I'd like to read it to you. It's called The Parable of the Twins. Once upon a time, twin boys were conceived in the same womb. Weeks passed, and the twins developed, and as their awareness grew, they laughed for joy. Isn't it great that we were conceived? Isn't it great to be alive? Together, the twins explored their world. When they found their mother's cord that gave them life, they sang for joy. How great is our mother's love that she shares her own life with us. As weeks stretched into months, the twins noticed how much each was changing. What does it mean? Asked the one. It means that our stay in this world is drawing to an end, said the other. But I don't want to go, said the other one. I want to stay here always. We have no choice, said the other. But maybe there's life after birth. But how can there be, responded the one. We will shed our life cord, and how is life possible without it? Besides, we've seen evidence that others were here before us, and none of them have returned to tell us that there's life after birth. No, this is the end. And so the one fell into deep despair, saying, if conception ends in birth, what's the purpose of life in the womb? It's meaningless. Maybe there's no mother after all, but there has to be, protested the other. How else did we get here? How do we remain alive? Have you ever seen our mother? Said the one. Maybe she lives only in our minds. Maybe we made her up because the idea made us feel good. And so the last days in the womb were filled with deep questioning and fear. Finally, the moment of birth arrived. And when the twins had passed from their world, they opened their eyes and they cried, for what they saw exceeded their fondest dreams. What a concept.